Hello everyone. I, Monica, along with my teammate Pramod, are here to present our presentation on the topic Information Retrieval in Healthcare. Moving on to the introduction to Information Retrieval in Healthcare. Information retrieval helps locate, retrieve, and organize data from large datasets, making information accessible and usable. In healthcare, where data is vast and often unstructured, IR is crucial for efficiently managing clinical notes, research articles, and imaging reports. By structuring this data, IR allows healthcare providers to access vital information quickly and accurately. This presentation explores how IR enhances healthcare, its benefits, and real world applications. So, how does information retrieval work in healthcare? IR systems in healthcare classify, interpret, and structure data from various documents, recognizing key details like symptoms and diagnosis. It involves data understanding, which is IR systems classify and interpret data in medical documents. Data extraction, IR identifies and organizes data, patient demographics, or diagnosis for EHR integration. Learning capability, advanced IR tools improve over time through machine learning. So, what is this unstructured data in healthcare? Much of the healthcare data, such as clinical notes and PDFs, is unstructured, making it challenging to integrate into EHR systems. Without IR, healthcare staff must manually process this data, which is time consuming and error prone. IR tools transform unstructured data into structured formats, enabling faster and more accurate processing. It is said that, according to a study by the Office of the National Coordinator for Health IT, 70% of the healthcare organizations struggle with unstructured data entry, highlighting the need for IR to streamline this process. So, what are the key benefits of IR in healthcare? Enhanced clinical documentation. According to a study by the American Medical Association, primary care physicians spend about 6 hours daily on EHR tasks, which takes up more than half of the 11.4-hour workday. This extensive time commitment to documentation reduces the direct patient care. So, impact of IR would be by automating data retrieval and entry, IR systems can significantly reduce this documentation burden, allowing doctors to allocate more time to patient interactions. Improve patient care. Research published in JAMA Network Open found that improved data access through technology solutions like IR could reduce adverse events in hospital as much as 20%, such that IR can be used to fastly access, organize patient information, and help providers make informed, timely decisions, potentially reducing the risk of medical errors and improving patient outcomes. It is also used in quick analysis of medical literature. A 2019 study from the Lancet highlighted that over 1 million new medical papers are published every year. This makes it nearly impossible for healthcare providers to stay updated with automated solutions. So, IR systems can analyze and summarize research quickly, giving providers easy access to latest medical information and support evidence based practice. Administrative efficiency. The US Centers for Medicare and Medical Aid Services reported that healthcare providers spend an average of 16% of their working hours on administrative tasks. So, by automating routine tasks like data entry and coding, IR reduces administrative time and cost, improving workflow efficiency and reducing burnout among healthcare staff. So, what are the applications of IR in healthcare? First of all, EHR. EHR is nothing but electronic health records. IR extracts and structures data, making patient information easily accessible in EHRs, reducing errors and supporting patient care. CDSS. CDSS is nothing but clinical decision support systems. IR-powered CDSS enhances diagnosis accuracy by identifying patterns in patient data and generating timely alerts. These insights support clinicians in making more informed decisions. Real-time alerts help prevent potential health risks and improve patient outcomes. Medical imaging analysis. IR tools streamline imaging data by quickly labeling and organizing radiology findings, enabling faster diagnosis. Automated annotations reduce manual review time and support efficiency. This allows radiologists to focus on complex cases and improves patient care speed. Now Pramod will explain you the basic tools that are used in IR that that would provide healthcare providers. Over to you, Pramod.
Thank you, Monica. So, on moving to the next slide. So, in this presentation, we are going to discuss about this IR tools which are being used in the total healthcare system that we have discussed in the above slides. So, the main IR tools that we'll be using in all the healthcare, all this Apache Solar, IBM Watson Health, Amazon Comprehend Medical, and Google Healthcare API. So precisely on moving each and everything. So Apache Solar is an open source IR tool which is mainly used for all the indexing, that means all the indicating and searching a large set of data sets which are often integrated, and that is which is having a specific EHR systems for quick access to any patient information. So what this mainly tool helps us is to do that. So what are the data sets of you will be giving to, you will be giving to the system of all the patients. So this tool helps us to integrate with the EHR systems. So that allows you to get a quick access. That means each and every information very easily. So what are the patient who has been treating, and each and every information we can get them easily from this tool. So for this Apache Solar, the main NLTK tool that we'll be using for this is the tokenizer and the POS tagger. So POS tagger is nothing but a part of speech taggers. So what this part of speech taggers does is that, so these mainly classify words into different categories. So that makes the search that we are doing much more suitable for the environment of the system, and which will be much more aware for the context, and it will also enhance the solar indexing capabilities too. So the tokenizers in the NLTK split the text into individual words. That means whatever the records that you have been submitted, in all these records this tokenizer tool will help you to split the text into individual words or any phrases too. So this is what the main Apache Solar tool does. So I'm moving to the next tool, that is the IBM Watson Health. So what basically it is like, it is an AI power tool that is mainly to analyze the patient data, and it also allows us to give us a proper decision, the proper guidance for the patient for the treatment, and also it helps us to identify the treatment option, in which way we can be able to treat the whole patient. That will be, it will be useful for indicating all such information. So basically the main NLTK tool that will be used for the IBM Watson Health is that name entity recognition, that is NER, and also chunking too. So for the main IBM Watson Health, in the usage when coming to this, NER will be useful to identify all the key entities, that is identifying all the diseases that the patient is been suffering with, and also all the symptoms that the patient is also facing. In the patient data we can be able to easily identify from all these. So this NLTK's NAR and chunking functions can also help Watson Health pass and classify clinical data more accurately, and it helps us to supporting the task like identify the relieving treatment options very easily. So on moving to the next is the Amazon Comprehend Medical. So what this basically does is that it extracts all the patient information and the medical information for the past history from the unstructured data, unstructured text. That means whatever is a plain structure that we have got it from the tokenizer by using. So all that this NLP service extracts the data from it, and it also helps in creating a criminal. Sorry, my bad. So it helps in creating a clinical documentation for the EHR integration. So for this Amazon Comprehend Medical tool, so the main tools that the analytic tool that we'll be using for this is the named entity recognition that we have used earlier, and the lematizer. So what the main limitizer does is that, so these limiters reduce words to the base form, allowing for them the consistent and standardized data extraction across various documents. So this mainly helps you, so all the complex data and even all the repeating words, all these things will be reduced by using this limitizer to the basic forms. On moving to the next is the Google Healthcare API. So the main tool that will be used for the Google Health API is the tokenization and the semantic text similarity. So what basically is Google Healthcare API is that it supports the data by organizing the patient data from various sources. So whatever the data that will be receiving from various kind of sources, like from other different tools and all those, this helps you in organizing them in a proper way, and it helps you get the specific insights very clearly. So in that, the tools that we'll be using are the tokenization and for the semantic text similarity. So what the analytic tokenization does is that it breaks the text into searchable components, while on the other side, the semantic similarity functions can help match and retrieve related records, ensuring consistency and aiding in the patient data integration. So, on moving to the next slide, that is the core NLP tools that we'll be using. That is these are the mainly tools that will play a key role in all the system. So, what those other tools are the SPECI, BioBird, MetaMap, and the CLAMP. What the SPECI is nothing but an NLP library, which is clearly used for medical specific extensions for entity recognition, like recognizing all the diseases and all the past clinical trials that he had gone through in the past, and on the text clarification and even the document passing in the health does. So on also next is the BioBird. It is a version of the BERT pretain on the biomedical text, and it also helps in extracting all the clinical entities and even understand the complex medical language, and what are the medical terms that will be using in the whole records. It helps you in easily understanding the what specifically it does and what it leads to, and supporting tasks like clinical documentation and EHSH also will be done. So on moving to the next is the MetaMap. So it is mainly developed by the National Library of the Medicine. So it helps you mainly standardize the medical concepts. I mean, what are the abbreviations and what are the key concepts and what are the unknown sources we will be getting from all the documents will be easily help you in identifying it, and it gives you an accurate data extraction and clinical support too. Moving to the next is the CLAMP. So it is a specialized NLP tool for mainly designed for the healthcare data, and is mainly designed to extract the clinical information and recognize all the entities and the classify, and it helps you in classifying the medical documents too. So on moving to the next slide, that is conclusion. So we can conclude in such a way that, so this transforming healthcare, and even it helps you in various ways, like even when compared to the information retrieval and NLP, both are these are very much growing networks right now in the whole system. So these help you in various methods how data can be clearly managed and turned into unstructurable information and actionable insights too. By these tools, we can even get high efficiency high accurate results with high efficiency, and it also helps you mainly helps you in reducing the manual workload that people might get when while documentation, and what are the entities finding, and all these things will be reduced on using by using these tools. So as NLP and the IR has been is as NLP and the IR are always a developing technologies. In future, if they advance, they'll further much more better healthcare workflows and evolve, and it will also help you in unlock new opportunities for the personalized medication and healthcare innovation. So in this way, we are concluding our presentation, and thank you for this opportunity, and thank you.